Okay, good afternoon. It's now 3 o'clock Geneva, European Central Time or Central European Time. Allow maybe 1 or 2 minutes for any participants to log in to the webinar before we start. This webinar being organized by the Private Security Governance Observatory, the International Code of Conduct, and DCAF. So if we bear with us for 1 or 2 minutes to allow a few additional participants to join this particular webinar. Perfect, thank you. Well, we'll start this webinar as I know that we're in different time zones and we have approximately 1 hour to go through quite a few key issues with regard to private security operations, private security companies in sort of the midst of COVID-19, looking particularly at the questions of strengthening regulation and duty of care of private security operators in different parts of the world. The main objective of this particular webinar is to look at how the role of private security companies has effectively been modified or adapted to deal with COVID-19 and the pandemic in different locations. We have seen, unlike many other services, that private security in many parts of the world has been labeled an essential service. And we've also seen private security contractors' tasks being maintained and being active despite the pandemic and despite the restrictions, the sanitary issues, as well as lockdowns. And in many ways, private security companies were also called upon to help provide security to essential premises and protect personnel in many locations. This, of course, gave rise to a number of potential challenges with regard to the appropriate regulatory framework, to the duty of care owed to security companies, to their own oversight in terms of their own actions, and then how did we see private security company operations evolving in those locations where tensions were arising with the local populations and civil society organizations. So a number of issues that we're going to try to unpack over the next hour. And to help me unpack them, or should I say, I'll be moderating those that are going to unpack these issues. I'm joined by 4 great speakers in different time zones. We'll have Dr. Sabelo Gumedze from Sierra in South Africa presently. Mr. Jonas Charles with Innovative Security Technologies Limited in Trinidad Tobago. I'm not sure whether it's in Trinidad or Tobago, but I'll say TNT. Ms. Maria Matui from Women Action Towards Economic Development, WATED, coming out of Tanzania, but I think presently in South Africa as well for the immediate future. And then closer to home, Ms. Emmylou Boddi with DCAF, the Geneva Center for Security Sector Reform. The manner in which we're going to run this webinar would be to try to make it as interactive as possible. So we have given our guarantees to all those that have dialed in to listen to this particular session that all 4 panelists would be succinct to the point, but will have quite a bit of substance in each of their answers. And we'll take this webinar through 4 key parts as such, 4 key questions that we each that we wish to address. But before going to those questions, allow me just to note a couple of technical issues, which seems to be the standard these days with Zoom communication. First, this webinar will be recorded, so you will have the opportunity to listen to it again in a not too distant future. And secondly, I'm not the technical expert, but I have been on a few of these webinars with Zoom so far. There is a Q&A facility available, as we all know, on this particular platform. So we would encourage participants and those listening in to put in any particular questions that they may have. We'll try to get to as many of them as possible. If we fail to do so, we can, of course, do a follow-up with individual participants and on individual questions as such. So without further ado, I'm going to give the floor to each of the panelists to allow themselves to introduce themselves and maybe just mention a couple of key opening comments that they may have in about 2 minutes each. So I'll start with the order that I have in my sheet here, and I'll pass the floor to you, Sabelo. for your introductory comments in the first couple of minutes. Thank you.
Thank you very much, Jamie. My name is Sabelo Gumedze. I'm currently working for a private security industry regulatory authority in South Africa. And we have been very much involved in ensuring compliance within the private security sector in South Africa, even during COVID-19. My recent work has actually been to look at the regulatory frameworks within the SADC region, and I'll be happy to tell you more about my findings. But thank you very much for giving me this opportunity to speak today.
Thank you very much, Sabelo, and welcome to this webinar. Jason, I apologize, the floor is yours.
Thank you, Jamie. I am Jason Charles, currently with Innovative Security Technologies Limited. I am the Manager Operations Efficiency there. I'm overseeing this new protocols with COVID-19 in terms of facilitating the changes that have been asked by our clients to ensure that both their staffing and our population is safe for persons to function. I have been in private security for at least 24 years. I am ASIS certified as a certified protection professional and a private certified investigator. I'm also John Maxwell certified as a leader, coach, trainer, speaker, and leadership. Thank you.
Thank you very much. And Jason, likewise, welcome to this panel. Maria, please, the floor is yours.
Thank you. Maria Matui from Tanzania. I'm working with Women Action towards Economic Development, an organization based in working at the national level. And we have been engaged on doing some sort of a baseline study on private security in Tanzania with a very key focus on women and gender participation. So I look into sharing on how civil society really can play its part on the pandemic times such as this, and how also women either affected or can be of influence to such incidents. So I look forward.
So thank you very much, Maria. And last but not least, Emmylou, the floor is yours.
Thank you, Jamie. So my name is Emmylou Boddi. I work currently with DCAF, the Geneva Center for Security Sector Governance, based in Geneva. It is an international foundation that aims to contribute to enhancing security sector governance through security sector reform. And within DCAF, I am part of the Business and Security Division that was created out of the realization that the impact of the private sector on security can be extremely significant, or is becoming increasingly significant, in particular in context of state fragility, where national governance is already weak. And out of the realization that security sector reform processes and the effort to promote responsible business conduct are rarely aligned, and similarly that private security sector governance is rarely addressed on wider national policies. And the Business and Security Division is trying to bridge these gaps, working with businesses, with governments, with civil society, and with community together to improve security, sustainable development, and respect for human rights. And I look forward to talking or to looking at how working with these different stakeholders has been key in responses to the COVID crisis in this field. Thank you.
Thank you very much, Emmylou, and likewise welcome to this webinar. So as everyone can note, we have rich experience and we have a variety of perspectives that we can bring to this webinar. Civil society organizations, regulators, security contractors, and organizations such as DCAF based here in Geneva. So the idea is we have 3 or 4 main questions that we wish to bring to the table and to unpack somewhat. And for each of the questions, I'll ask one of the panelists to take a lead in taking the first stab at an answer. And then this gives a luxury of time of thought for the other panelists to then respond, compliment, and or criticize, if need be, the initial answer. So we're going to look, I think, specifically at this stage, before taking on sort of the governance piece and the sort of the regulatory component, very much look at the questions linked to what roles have we seen private security companies sort of take on board during the COVID-19 crisis. So I'm going to turn to you, Jason, first, if I may, and ask you quite a specific question in terms of COVID-19. And asking you, do you think that COVID-19 has created sort of new roles for private security companies during the pandemic? And have you seen this sort of the pandemic and sort of the management of this pandemic requiring private security companies to acquire new skills as such? So new roles as well as new skills for private security companies. Jason, the floor is yours.
Thank you, Jamie. Yes, COVID-19 has led to new roles for security companies. And namely and primarily, the role that has been new for us is that of what you call a medical professional, or almost as a health worker, a health professional. In that I say, we are now required to do temperature testing for all employees, all members of the public entering any space. That is something absolutely new to security. That was predominantly a role that a medic would have assumed. Those international bigger companies that do have medical personnel, that would have primarily been their role. But now as the first liner, we are now asked to step into that position and to also ask questions related to that you will find at a health facility. For example, we are asked to now have persons answer, have they been in contact with persons who have been tested for COVID-19? Have they themselves been tested for COVID-19? Have they experienced a fever? Have they been coughing? So questions just as a pre-screening before we are allowed to take the temperature. Now, with that new responsibility of taking the temperature, it also puts us, when I say in the funnel, in the sense that most persons will usually use their strong hand. So you now have security personnel using their strong hand, probably to take with a temperature gun, while trying to manage controlling the flow of a door, or having to now also probably help persons sanitize their hands, because some establishments and some places, security are asked to manually have persons or put sanitizer in person's hands as one of the precautionary measures before entering the facility. Now, this requires a new level of training for us in terms of how do we conduct temperature tests. How is that cascaded down to the wider population so persons can do it correctly? Now, we are also at a point where there are different schools of thought. Should it be done at the forehead? Should it be done at the forearm? So now you have a confrontational issue based on how learned persons are entering the space. Because someone may object to a gun being pointed at their head, because that's not the new normal. That is not something we should normalize under other circumstances. In fact, you have a gun pointed at your forehead. And you have that resistance. In some instances, you have security now being asked to be a first aider, which is not primarily their core function under normal circumstance. Because of persons hardly being in the workplace, they are now asked to monitor floors. They are now asked to be floor wardens in the event of any alarms, any different things going off.
Sorry, Jason, we lost you in the last second there.
Sorry. Other persons, organization would have normally had persons as floor wardens. So you now have security taking up the responsibility of floor wardens and even first aiders because of the reduced strength in the offices. So this is what COVID has done. It has brought a new responsibility, primarily having security as procedural overseers of what you would normally be health type of issue or control mechanisms.
Yeah. Thanks for that, Jason. It's interesting because actually what you're saying here is we're effectively seeing the security piece in terms of the traditional security operations that private security guards officers provide now being substituted with a more medical type of responsibility, which in some ways means that the security component no longer exists as part of their sort of when they're involved in that particular situation, and it could undermine the work that they're carrying out as security guards.
It does. It does bring, now you have to balance which one takes precedent, because while conducting temperature, you have to maintain your vigilance. You have to be aware of your situations and those who may be coming, because now everyone is masked. So you're not even sure as to who you are seeing entering the space. So yes, it proves a little more challenging in terms of personnel called to be more focused and disciplined. and to also have a little more empathy and empathize and relate to those who may come before them.
Perfect. Thank you very much. I mean, I'll turn now the floor to the other panelists. Maria, your thoughts on this and from your experiences? You'll have to unmute.
Well, I was more attentive and looking at the practicality of what is happening. And maybe, I don't know if it'd be a question or a comment on what Jason was saying, but for me is the experience of asking, I mean, security officers asking the clients, whatever that could be, if it's in a mall, if it's in a hospital, if they're trying to use that temperature, the thermometer, if it's not functioning, they try to find alternative places where they can plug and get the temperature. How does that balance their ethical practices, and what has been the training to those security guards? That's what I don't know. And at times you see frictions between clients and the security guards. So for them, they're doing their job. But for a regular citizen, part of that is some sort of being maybe unoffensive or too much of a process which delays whatever they want to do. So I really see the COVID-19 putting the private security sector in a juncture where there is a need of thinking through, when such incidents are happening, how prepared the security sector is and how collaborations exist. For instance, medical personnel and the security officers. How closely related these two functions come together. I don't know if that's a question or it's rather more of a comment, but to me, this is always something which troubles me as a person. And I look into those people who are trying to do their job, and sometimes the equipment that they're having, they're not even sufficient. The mask that they're wearing, they're not even enable them to do their work more efficiently. Now look at the person who is standing or being at a place for more than 6 hours. He has to have that mask on, he has to stand, he has to make sure he's putting that the measurement, the thermometer on these clients. But what is safeguarding, or what are the measures of making sure the COVID-19 is not really direct impact to a security guard at that particular moment?
Thanks, Maria. Now, Jason, I'll let you come back to that after I've heard from Sabelo and Emmylou. But again, I think that's the other side of the issue. So you mentioned already the interaction between the security guard on the one side and the member of the civilian population as such, coming in to the hospital and being temperature tested. And then that kind of tension between the two. But then there's also the flip side with regard to the protection for the security officer himself or herself, in terms of how are they protected against the potential infection, and then how can they be deemed to be doing their job efficiently if they are carrying out, for instance, this temperature testing with maybe faulty or deficient equipment over a 6 to 8 hour shift. But I'll let you reflect on that in a few minutes. And let me quickly turn to Emmylou first. Anything you would like to add at this stage of the conversation?
Unmuting the microphone. Just basically concurring with what Jason and Maria actually already stressed. I think it's clear that COVID has indeed implied a change of the role of private security, or at least a change of how they have to perform their tasks. And in many cases, we've seen that these changes has happened very quickly, and that insufficient training and information were provided to private security guards in relation to these changes of what they have to do or how they can protect themselves. And when it comes to sanitary measures, they are very exposed. They need to be well informed and equipped to protect themselves, but they are the person responsible to enforce these measures in a lot of cases, and they should also be able to explain these measures to the person that they are. You mentioned that they're taking temperature, that they're pointing a temperature gun to people. They need to also have the right way to explain to people what they're doing to avoid conflict. And I think a main point to all of that is training. Everything happened very quickly, and training is in a lot of context not following up adequately. So that would be my reflection on that.
Thanks, Emmylou. I think it rejoins, as you mentioned, I think both Maria and Jason's comments in terms of how do you prepare the guards for this kind of new situation, this new environment. You expect them to take on new roles and potentially develop new skills, but they don't have your 3, 6, 9 month kind of training cycle. It's from one day to the next, and they're given a certain set of equipment and potentially untested protocols to carry out these new, let's say, activities which are not traditional security guard activities as such. Sabelo, I mean, I'll turn to you as a regulator, and as a regulator who's basically very much been looking at security guards in a sort of traditional sense. Anything you would like to add at this stage as well to what has been said so far by the other panelists?
Well, thank you very much, Jamie. I think Jason has already laid a very good background on what is actually happening. I think from what he has said, we are seeing a new definition of what a security service is. And I mean, for me, it goes back to the legislation that actually establishes the regulatory frameworks for private security. Because if you are saying that as part of rendering a security service, therefore it means that you need to do other responsibilities that are over and above a security service. And for me, it points to the fact that perhaps there was a need for proper consultation within the private security sector, so that when they are roped in the fight against COVID, at least there are those kind of clear guidelines. Because I'm also seeing the exploitation of these private security guards being used for these kind of purposes without being remunerated, but also risking their own lives. And I think for me, I think for every effort to fight COVID, it is important that, you know, regulators are a part and parcel of these kind of consultations, and also the private security providers are also part of this kind of deliberations. Because now what we saw was just whilst they were becoming now essential workers, but there were no measures that were put in place in order to ensure that they are safe. You know, looking at a very good example where a private security officer is working in a hospital, and they are confronted with people who are infected. But when you get inside the hospital, you find that nurses are more equipped than the private security officers that are actually the frontliners. So for me, I think Jason has hit it, and I think there's a lot of discussion and a debate that we need to engage in on this point.
Definitely. Thank you, Sabelo. So before turning the floor back to you, Jason, maybe to sort of wrap up this sort of first section, I think what I'm hearing, of course, is a question of, you know, consultation. How do you prepare the security guards for these so-called new roles and new skills? No doubt there is also the question as to whether or not the security guards should be the ones basically be given the responsibility for this so-called new medical kind of responsibilities. And the question I'll put to you in terms of something I saw on footage emanating out of a news coverage actually from South Africa, linked to a particular crisis in a certain hospital, where we saw footage of a family bringing one of their sick relatives who was unable to walk and literally carrying him out of the car. And those that brought the stretcher to the car were security guards, not wearing masks, not wearing gloves, and they were the ones helping the family put the sick individual onto the stretcher when doctors and nurses were elsewhere carrying out other certain activities. And so my question then, I was quite, I would say, shocked in a sort of understated manner to see that it was the role of the security officers to be handling, which is not their role, but handling individuals who are potentially ill. And then the next question that went to that, how then do you protect the security guards themselves and then their families? And this is the duty of care question that comes into it. If the security guards are so exposed, what do the security companies and the hospitals do, as well as the authorities, to protect the security guards themselves from contaminating potentially their own families? So Jason, I know there's a lot of issues here in a small amount of time. Anything you'd like to add or sort of complement before we move to sort of the next section of this discussion?
Well, one of the things for sure that I've also, I can report that I've seen is that companies have taken the initiative to ensure that their security, some of them have all the required PPE, as it ensure that they have the correct masks, they have washing stations close by, they have removed some of the responsibility, for example, of searching persons. So you now have persons who will self-search to assist with that unnecessary actual contact where it used to happen before. In terms of how do you protect your family, some companies have taken the role of actually picking up their security personnel from home. They bring them to the job site. Before they board the vehicle, they will have them test their temperature. They will sanitize the vehicle after every courtesy transport. So some companies are taking the initiative to try as much as possible to mitigate between work and the office, you know, or their jobs, their place of work, their officers' behavior. There are lots of literature going on. There are lots of consultation dialogue among some companies in terms of executive encouraging officers to really practice social distancing. They're sharing information from the health authorities. So to a certain extent, some companies have been responsible in terms of their care to their officers. You know, there's a rule that if you're not feeling well, you yourself don't come to work. Don't feel obligated that you have to come. You know, we understand because we're trying to ensure that there is no kind of spread and that you are not the person responsible for infecting someone while trying to safeguard yourself. You know, so it has been a lot of, some dialogue has been taking place. There has been some efforts to control in Trinidad, at the health facilities. There's a triad station where the nurses interact, not necessarily private security. But for other corporate and regular businesses, yes, the security has gone into the first line. And for me, they could have some training from medics. Medical professional could at least pass on that training to the security to equip them, because most times the training is being done by a member of the corporate security or security themselves, in terms of you read off the thermometer or how to conduct the test, and you're given some guidelines and said, okay, this is what you're asked to do. But you should have some involvement of medical professional in the training and preparing security psychologically, because for the first time, we normally look against physical threats. We are now faced with an invisible threat, which psychologically, it's also, you're not sure what you're facing. You're not sure who has it and how to deal with it. Yeah. So some consultations, some more training, some medic involvement, and ensuring that person have the right PPE, and we encourage the right behaviors as much as possible for persons on the way to and from home, and ask them to be responsible. Thank you.
Perfect. Thanks, Jason. Quite a few good recommendations there as well. And one that I have heard being suggested as part of this conversation is maybe you will have a situation where the security companies themselves and security guards should have greater remuneration, in a sense, like that kind of danger money as such, because it's a new set of responsibilities to deal with non-traditional kind of activities. But I'm sure that's a separate panel discussion, which we'll have maybe more time for later on during this particular webinar. Let me move a little bit so the discussion towards kind of the regulator sort of oversight piece. And Sabelo, I'll turn to you first, and you've alluded to that already as part of sort of the last sort of round of discussions on that first question. And I think to me the question is, you know, what opportunities and challenges has the COVID-19 pandemic presented for private security oversight? And do you see new trends for COVID-19 in terms of oversight, new potential ways of looking at regulation and oversight from your perspective?
Thank you very much, Jamie. I think we need to start from the beginning before we even get into the role of the regulator, because as you know, in a case such as South Africa, for example, there is the so-called Disaster Management Act, and out of that act, that's where the declaration of the national state of emergency comes from. And out of that declaration, you have the regulations. And within the regulations, they address what should happen at different levels. For example, you had alert level 5, 4, 3, 2, and 1. And the most unfortunate part was that during the promulgation of these regulations, regulator for private security was not involved in how the private security sector will play a role in addressing COVID-19. We only saw the police and the soldiers being part of an effort to ensure the implementation of those regulations. And during the lockdown, we also saw private security officers continuing to work as they were considered to be essential services. And I think Jason has already touched upon this. So during the fight against COVID, you saw these private security guards becoming the so-called health inspectors, checking temperature levels and sanitizing people without even understanding what they were doing, because at the end of the day, they were just informed, this is what you must do. But the other side of the coin, the human side of the private security officers was not considered, because I think it's very important. So what should the role of a regulator be, having looked at this? And I think it is important to go back to what each legislation says in terms of what the regulator should do. So regulatory agencies are usually established by the law, and the law actually states what kind of objectives that regulator should be. And I think it has to be flexible enough to ensure that the regulator plays a part in firstly ensuring that there are minimum standards for occupational conduct in respect of security providers. So in this way, there's a need for regulators to ensure that there is constant inspections, monitoring of compliance within the sector. They also need to ensure that officers are safe, and the masks that they use are such that they are these medical masks, because they are always in constant contact with the public. So it's also important to also understand that within the private security industry, there are low barriers of entry. So you have a lot of security guards involved there, and the exploitation increases when there is no monitoring and inspection of these private security industry officers. So one of the opportunities that we have seen is that there is a need for regulators, for example, to ensure that infections within the private security industry is documented. And over and above that, there has to be the tracing and indexing processes within the private security industry. Because as we are speaking now, we are not aware of how many security officers have actually been infected and how many security officers have actually passed on, and what kind of measures we can put in place. But it is also important to note that regulators should also, consider opportunities of developing a COVID special fund, obviously with the assistance of government, but also it's also important for regulators to understand that these new roles and new skills that are within the private security industry as a result of COVID have to be addressed. So there's a lot of potential for regulators to play a role in ensuring, one, that security officers are safe, that they are healthy, but two, to ensure that within the security industry there is no exploitation. But thirdly, to also ensure that there is no abuse of unregistered security officers, because we have also seen the use of unregistered security officers in this space. So regulators are supposed to be even more vigilant during this time to ensure that compliance with the law. Thank you.
Thanks, Sabelo. I mean, quite a few issues there as well. We could do an entire webinar on that too, in terms of the role of regulators. And I think just noting a couple of points and allow maybe the others to think about this as well. In addition to what you said, one question that came up, and it also goes back to, I think, the first section we had here, and maybe we need to look at that as well from a regulator perspective, is if we're expecting security companies to provide PPE, additional equipment, sort of a health and safety standards to be increased, those will, and one of the questions from a gentleman by the name of Salman Taylor came in, there'll be mounting costs that go with that. And ultimately, at some point, someone's going to take on board those additional costs that go with the additional equipment that's being provided to security companies. And where does that additional financial burden lie in the so-called supply chain? And there's also a question that came up with regard to uniforms. Should there be maybe different types of uniforms, and should we redesign the uniforms of security guards so that there be those that are more the security in a proper sense, vis-a-vis those that provide in a security but more in the medical sense that Jason alluded to? But let's take it back maybe to so much more the role of the regulators. Emmylou, with sort of DCAF's work in this regard, and do you see any sort of opportunities in this regard with regard to oversight based on the COVID-19 experience for greater governance and sort of regulation?
Yes, actually, maybe taking a step on a wider look and not talking about one particular country, but a little bit of our reflection on what we had seen and similarities in different countries in different contexts. We've seen that the COVID crisis has impacted private security actors really heavily in many different directions. For some, it meant losing their jobs, actually, with no alternative, very low social helps. For other, it meant additional workload and new roles to undertake. And in these new roles, many private security actors have been called upon to supplement or to support public security, and private security has, in a lot of contexts, actually gained a lot of visibility. And I see these changes on the terms of regulation as maybe presenting also an opportunity to bring good governance of private security to the public agenda. It is something that is still, there's not a lot of awareness about public security. There's not a lot of talk, and it is often not really addressed in the wider security framework. So there might be an opportunity here to use this new visibility to raise awareness on the challenges, on the opportunity that the operation of private security offer, and to improve the public perception of private security, and an opportunity to get together and address these needs to include private security into wider national security policy in general.
Thank you very much, Emmylou. So here we're talking about this also being an opportunity to demonstrate the added value that private security can have in terms of an effective, essential service during a situation like a pandemic. But again, you'll see in the chat a number of questions coming up, again, always related to the cost, to health insurance issues, to how do you protect the security guard, and ultimately who covers that additional sort of financial burden for security companies if we're going to apportion to them these new roles and responsibilities. So before maybe going to Jason, Maria, anything from your perspective based on sort of the governance structure and the issues that both Sabelo and Emmylou have touched upon so far?
Maybe I'll speak from the perspective of Africa. Maybe Tanzania would be the case, and I think it's the way that COVID-19 really the government was responding. Some sort of maybe not well planned. It was an immediate action, though progressively we have seen somehow, somewhere trying to rectify some issues which were not properly captured. Maybe building from what Sabelo and Emmylou said, I really see the opportunity. For me, I see big opportunity, but the question which still lays behind is this opportunity, how is it going to be harnessed by both private security and the government instruments? So at the private security sector bodies, those who are working from the grassroots to international level, how they see this as an opportunity, and how the policies within those companies will now come to bring about more protection, but also more engagement with the government sector, but also ensuring the private security and those who are working within the sector have more opportunity of being protected within the pandemic, but also the laws will have a leeway and a room to ensure that just in case such a disaster happen in the context of needing other sectors to come jointly, how can that be timely be responded and having an engagement going forward without leaving other actors behind.
Yeah, thanks so much. So again, so using this as a reflection that, of course, what was put in place initially because of COVID-19 was very reactive and not necessarily well thought out. And this is an opportunity now to maybe tighten a little bit the regulations, roles and responsibilities. So with a couple of minutes we have left on this little session, Jason, I'll turn to you, but I'll also ask a quite specific question, which has come up in the chat. Life insurance, liabilities linked to the pandemic for security guards that are taking on these new responsibilities. Who should cover that? Should it be the security company or the authorities that are requiring of security guards to take on these new responsibilities?
In terms of from where we sit, some companies, or a lot of companies actually, the private security are insured, do have insurance coverage. So while they're out of the field, should something happen to them, their medical provider will cover that initial cost or cover a portion of the cost. Similarly, with the introduction of the new responsibility and ensuring that officers have the right PPE and the right equipment, there has been a cost and a spend increase. Now, some players and some clients have been welcoming to meet the company halfway in terms of providing the necessary equipment required. They have gone and extended themselves to ensure that they have fulfilled their obligation to support the drive to ensure safety across. Now, in terms of regulation, you have different players almost as though applying how they see their different protocols to what has been existed. Now, I always say that we should really have what you call complementary and sharing of information, because now is a time to standardize what should be practices in the industry where security operate and how they operate. People have different practices within it. Now, those that have the benchmark guidelines should basically share. So we have a community sharing what should be standard protocols, how it should be done. Then you have that oversight to ensure robust regulation and that there's no exploitation of security. And legitimate and registered companies are those at forefront, especially in major issues and major protection at this time. It was noted that you have the use of unregistered private security personnel, and that is true. Now, you need to manage that in the sense that with oversight and regulation, you now have what you call your checklist to ensure that your company gets a license to operate as a private security provider. And that is the kind of conversation and consultation needs to be taken where there's new training, because there must be oversight as to the prerequisite training that the security is now required to execute and deliver. Not it should be left at the discretion of management or of the respective companies to ensure their personnel do. There should be some oversight and some verification as to credential and certification.
Thanks, Jason. So, Sabelo, I'll turn the floor back to you for a very quick response to anything that you've heard so far, any addition on any sessions, any questions that we've raised in this particular section.
Thank you, Jamie. I think the one that I got interested in was who should cover the costs. Remember that we are in, this is a national disaster for every state. And governments have actually come up with plans on how to address the pandemic, and they've put aside a budget for addressing these by purchasing PPEs and so on. And it goes back to what I was saying, that when these regulations were promulgated, or when these regulations are promulgated by each individual state, the private security regulator and the private security industry must be part of that consultation, because that is where now the issue around, now that you are part of the so-called essential service providers, what are you going to help us with? So you have those private security companies who are in hospitals, you have those that are in public offices, and then you will then determine that there is a need, for example, to provide uniforms for the private security as service providers that are working in these kind of spaces. So at the end of the day, it is the responsibility of government, because governments are responsible to ensure the safe and healthy and health for their citizens.
Perfect. Thanks, Sabelo. So here we're, responsibility of governments, especially when we're dealing with these matters and working in particular with the regulators to ensure that we have the right frameworks in place to address exceptional circumstances which may become the norm at some level. So there's another set of actors I'd like to turn to now, and I'm sort of looking at Maria in particular, civil society organizations. And again, we've touched upon some of these issues already during the discussion. I mean, do you see potentially, because of COVID-19, I think the experiences of some of these security companies in different locations, a new role for civil society organizations with regard to governance of an oversight of private security companies?
Mm-hmm. Thank you. So I think I'll just build on to my sort of suggestion and comments from previous speakers. And for real, like certainly civil society plays a watchdog role, one would say that. And certainly the issues of legitimacy, accountability, and transparency are very key and crucial in ensuring that not only that human rights is observed, but timely also people are able to work freely in their own country despite of the circumstances. And I would say, maybe again, I'll give the example of Tanzania. COVID-19 came so abrupt, and it was such a moment where, as an individual state, everyone was still in a shock how to react and how to respond. So it took almost a freeze of maybe a week or so for civil society to gather together and find out what could be their role that they can play to ensure that those who are not able to receive information, particularly, how are they not affected with the COVID-19? Because for me, when I look into the impact of pandemic, not only on the regulatory aspect of it, not only on the private security, but what about those people, citizens within respective countries? Are they well informed? What about those who are working in these sectors? Are they aware of what is happening? So look, for instance, an example which we just gave a few minutes ago, a private guard security goes to work in the morning and then goes back to his or her home without having any other form of information, how he can protect himself, how he can protect his family. But then he must earn his living so that he can be able to support his family. Some states were able to have some subsidies so that they can be able to substitute some livelihood to certain families. And some did not have that plan in the place. So how can civil society come in? And for me, I really see that the role that the opportunity maybe that the COVID-19 is bringing in place is filling the gap which we evidently seen. So as I gave an example of Tanzania, we convened civil society meetings in two different perspectives. One was generally for every civil society which works in the country, and the other one was specifically looking on the gender issue. So how women are affected, how girls are affected. Schools were closed and there were concern of early marriages, early pregnancies for girls who will be staying at home. How are those going to be responded, and how are they going to be impact lives of those who will be staying at home? And then there are these women working in the informal sector, I would say generally whoever that work in informal sector, how are they properly informed? For the case of Tanzania, we didn't have proper full lockdown. So we only have some measures in place, such as social distancing, sanitization measures, but the rest of life was moving on in sort of maybe 50% to normality. So the schools, when they are closed, girls going back to their families, they have to support their families, but then there are not really much of the circulation of money within the market sector. Then there was that dilemma, how can we come in? So with the conversation that we find out, the best way the civil society that can do, and this could be an example that I'll give to a general perspective, is to engage with both parties. So within the civil society sector, what the gap that we see, and now I'm noticing, we did not engage private security at all. They were not part of the conversation. So civil society came in as civil society themselves without having private security part of the discussion. And then civil society then, after coming with their resolutions, they decided to engage other actors. And who are the actors who were engaged? These were regulatory, the ministries, the department, the police officers and such not. But again, you don't see private security on the line of engagement throughout that conversation. On the other arm, then we decided to engage the respective Ministry for Gender, again with the issues of what could happen when this lockdown will happen, people staying in their houses for I don't know how many days. That is not the normal life that people are going to use. What about sexual gender-based violence? What are the issues? How can they be reported? What about the human violation? How can they be measured and be monitored? Who will be responsible for all that? And again, here we are cognizant of shrinking space of civic space. So how best we could harness those opportunities. So fortunately, because of the understanding of the shrinking of civic space, but again, understanding this was the pandemic and we had to engage either way, there are certain measures which came into place. Part of that was releasing a manifesto or on measures which we believe government should harness, given that all of us as civil society would not be able to engage with the government. So that we prepare a document which was shared by the respective government ministry. But again, we had several interactions with the respective gender ministry, whereas part of that was to identify a task force which would work closely with other actors to ensure that issues of gender-based violence are properly reported, are properly monitored, and are properly taken measures just in case of violation of human rights. But again, what I see and what I would like to register is the lack of information. So I am talking about the elite group, and this is for the lack of better word, which were able to access information, which were able to see where that information could be reported and could be used. But the majority of the population, the country that I'm coming from, they reside in rural areas or peripherals. So here is the issues of access to internet, the issue of access to mobile services, the issue of access to even even a flyer or news information that can flow to these particular groups. That was not accessible, that was not available, and that was not even an issue which most of us saw that we could be able to address at that particular time. So it took really time for civil society to understand and to maneuver the ways that we could otherwise then know we can use other measures to ensure that the private security, I mean, the issues of COVID-19 does not only have effect to people residing in urban areas, but what about those who are in the peripheries? What about women? And on the other segment, when we come in the issues of private security, they were not in the picture at all. And more unfortunate, even the umbrella that are working with the private security, they were nowhere to speak about issues of private security. So we didn't have any flow of information from that other segment. Maybe the lack of having proper regulations, for instance, in Tanzania, we're still working on having regulation for private security. At the moment, everything is done under the Inspector General of Police, who has other responsibility as a state bearer to ensure the protection of all citizens in the country. So the private sector themselves, they were not proactive to engage. They are not proactive to come forward and say, these are the issues that we want to discuss, and these are the issues we think either civil society or the government can take forward. So I see...
Maria, I'm going to have to pause you now. I apologize. But it's actually a good segue, because we also had an additional question. So before, rather than tackling everything that you've mentioned here already and giving the floor to Jason Sabelo, maybe I'm going to turn to Emmylou at this stage as well, because I think there's an area I wanted both of you to look at, was that role of civil society and how, I mean, Emmylou specifically, and it's sort of one of the questions we discussed, you know, what role do you also see from your perspective at DCAF and through a multi-stakeholder approach, what role can you see civil society playing alongside sort of governments and industry to address the effects of COVID-19? And then I'll turn back to Jason Sabelo as well, and Maria as well, for yourself.
So we're going straight under, not commenting directly, Maria, but rather my part of the answer, right?
We're going to consolidate everything because we have about 10-15 minutes left, yeah. But there's a segue, there's a nice overlap between the two.
Fantastic, yes, and thank you, Maria. You touched upon a lot of points that are actually crucial and that we worked on together. So thanks a lot for your speech. Just taking a step back again, maybe to say favoring multi-stakeholder approach is not something that we started in relationship with COVID. This is the provision of private security services, whether they're classical person or property protection or more advanced services such as training, weapon maintenance, or anything else. It directly impacts security as a public good, and the oversight of governance of private security is critically important. It's not something that someone does on its own in a corner. It's a national matter. And it is recognized by all actors, actually, that in many cases, the regulatory approach is not sufficient to provide this good governance of the private security sector. We have governance that found that they are often unable to regulate private security companies effectively and to hold them accountable. We have civil society organizations that report on incidents involving private security companies that violate human rights, but they see very little effective follow-up. And then we have the private security companies that found themselves to be subject of very heavy criticism, sometimes to the behavior of very few, and their activity actually may suffer from this bad reputation. And in this framework, when you bring everyone, all of the relevant stakeholders from government, from companies, from civil society, is a way to start a new dynamic, to open the dialogue about what are the challenges and what are the opportunity presented by the sector for each stakeholder, and to build an answer that actually gives an answer to all of the different stakeholders and all of the different points of view. And maybe bringing one example, the DCAF has supported the creation of the Private Security Governance Observatory. The observatory was created in 2014, and it has built an African network of civil society organizations that play an active role in promoting good private security sector governance. It now counts around 80 members and represents around 21 African countries. And this network, it facilitates capacity building and experience sharing amongst its members and prioritize the creation of multi-stakeholder dialogues and these partnership with national stakeholders, including communities, private security industry actors, clients, and government actors. And I think Maria mentioned actually one of them. In 6 different countries of the observatory, we've developed baseline study on private security to address what does the national private security landscape look like, analyzing the legal framework and identifying these challenges and issue recommendation. I encourage you to look at them. They're available on the website, but what's most interesting for me, more than the study itself, and what I want to talk about here, is the dynamic that these projects have kind of started, the new relationship that these projects have created. It was a little different in each national context, of course, but to give you a few examples, in Guinea, for example, the research was welcome. It was seconded by the regulator, who saw it as an opportunity to actually include private security into an ongoing national security sector reform. Same way in Nigeria, the Nigeria Security and Civil Defense Corp, responsible for private security regulation, actually welcomed such a participative process by a civil society organization as something very innovative. And it's also facilitated the project and is supporting the implementation of the recommendation. And when we look into now the COVID crisis that affected the entire world, these existing multi-stakeholder relationship, they're open linked between civil society, regulatory authority, private security companies, actors, and communities. And they are proving to be a great asset. These are already open, and I think we just need more of these kind of open forum, open discussions.
I'm going to have to stop you as well in a second. We've got about 5 minutes left. I really apologize. It's a tight schedule. We have about, I hope we had an hour and a half, but if you have a couple more points you want to make, then I'll have to sort of hand the floor over to everyone else to add a few additional comments on the CSO and multi-stakeholder partnership. But Emmylou, anything else you'd like to quickly add?
Then just jumping directly to a conclusion that basically these multi-stakeholder working group, they're basically, I think, linking all of the issue that we discussed under this panel, and that these trust relationship between all the actors are actually or can be essential early warning and mitigation mechanism to provide platform to exchange constructively so that no one feels left out, that every single challenge is actually heard and addressed, and that we can find possible innovative and, very important, sustainable responses to all of these security and human rights challenges that are created or exacerbated by the COVID crisis.
Excellent. Thanks, Ed. So I'm going to turn the floor to Jason and Sabelo there. I mean, there's a lot of issues here that we're looking at. So I'm not going to sort of put them all to you, but I think the point that Maria was making in particular of that engagement between civil society organizations and private security companies as an example, something which was potentially lacking in Tanzania initially, and how then do we overcome that, and how do you, basically encourage that greater sort of relationship between the two sets of actors. And the points that Emmylou was making there in particular, the added value of that sort of multi-stakeholder approach of having sort of the regulators, government authorities, security companies, and civil society organizations working together, which basically have that much more added value, in times like COVID-19, if we build on Maria's point about that lack of interaction. So there's a lot there. Sabelo first, then maybe Jason, any 1 or 2 points you'd like to pick up on fairly quickly, and then we'll do a quick wrap up sort of comments from all of you. Sabelo?
Thank you, Jamie. Whilst Emmylou and Maria are pushing for this cooperation between civil society and private security industry, from our side, we have partnered with DCAF, looking at the role that private security regulatory authorities can play in this space by ensuring that there is some kind of a network of these regulators, so that we can be able to share experiences and also to cooperate with the civil society organizations, because I think any partnership that can be a workable a solution to this issue is a partnership that will also involve regulators in this space. So that's my comment.
Thanks, Sabelo. And maybe offline with Maria, we'll talk about how the sort of the regulator perspective in Tanzania actually works, because I know Sabelo of Syria have been fairly active, but more in East Africa would be quite interesting. Jason, from your side, that interaction, civil society organizations, regulators, multi-stakeholder approach.
For us, I think there's much needed consultation, in the sense that we in the private security and government have to appreciate the role civil society plays. They are basically the watchdogs over what we do. And we must invite and encourage that kind of dialogue. You see, there's a school of thinking that civilians are not always able to contribute to these kinds of conversations, but those of us who are in the industry have sometimes what you call a self-serving agenda. So you sometimes push out that, and you don't want to get into that stakeholders dialogue, because you don't want persons calling out some things that need to be done and corrected, for example, that oversight and regulation. So it's much needed in terms of that level of consultation. I am glad to see that these conversations are taking place internationally and regional wise, because it's very important that we all share our experiences and able to partner and support each other as we try to improve the situation. But definitely a mechanism for oversight, definitely consultation, and to the sharing of information, because information is important so persons can be guided and make informed decisions. Thank you.
Perfect. Thank you, Jason. So what I'll try and do is I'll quickly wrap up very quickly before giving you each the floor again for any last sort of comments that you wish to make. But I think certainly what we've heard here as part of the COVID-19 crisis is that we've moved away from a sort of them and an us kind of approach, you know, the security on one side and the rest of us on the other side. And that ultimately we're all in the same boat in terms of how we had to address these issues, and that many of us, and I think all of you alluded to this, what was lacking was information. What was lacking was consultation, and that's part of the lessons learned we need to take from COVID-19 in terms of preparedness, in terms of engaging, in terms of consultation between the different actors. What I've also heard, and this is where I think the financial piece is fascinating, in terms of the costs. There are additional costs, both in terms of lost revenues, but also additional costs that go to security contracting and others. Civil society organizations in terms of budgets, how can they do their work when we have sort of major economic restrictions because of COVID-19? And then where does that cost lie in terms of who picks it up? There was an interesting comment that came through one of the chats from an individual as part of our conversation here, that governments potentially should assume the cost, and the question of insurance companies playing a role. And there was a negative example given that initially insurance companies covered the medical costs linked to COVID-19, but when they issued new policies, that COVID-19 became something which was no longer covered as such, as part of the insurance policies. So there's also that business element in terms of the other stakeholders that we need to look at in the management of these this pandemic. I'm aware of the time. I can give each of you maybe a minute each, if you wish, or a minute and a half at most. So Maria, the floor is yours. Anything you want to wrap up, compliment? I know I cut you off earlier, I apologize, but we are tight.
Thank you. So I really see opportunities, and the stage that we are as a country, we are heading at establishment of a regulatory systems. So for me, I see this is a very timely, and more partnerships and engagements are welcoming. And we have, we at the private security, we need to see how we can have safeguard, early warnings, and preparedness strategies, which can bring together all stakeholders going forward, that as we keep on learning, and this also harness the human rights aspect of it, but involvement of other actors, including women and those who are residing in peripherals, and other genders which are otherwise will not be able to get informed or be participating in these spaces.
Excellent. Thank you very much, Maria. Emmylou?
Yes, the entire world is under a crisis, and things are moving, things are changing. We're talking about security, which is a very, very sensible topic and touching upon everyone's life. And the fact that things are changing that quickly also means that we have an opportunity to precisely address also these challenges and make them change in the right direction, involving and discussing with the right person, bringing all the stakeholders together in a room. And one of the key words that I think all of us had in this session is information, and maybe just add in one actor that we haven't really mentioned here is also the key importance to media in parallel to regulators' work, to civil society's work, to companies' work also. Media was also named as an essential actor, and I think they are also a fundamental actor to keep informed and to basically help getting these discussion going, getting this dynamic into the right direction.
Perfect. Thank you very much, Emmylou. Jason.
Well, this has definitely brought to the forefront the need for all stakeholders to collaborate and to work to bring in the best solution to ensure persons are looked after. There is no infringement on human rights. Officers are not exploited. One of the takeaways for me is that need to have a different financial conversation, because yes, not everybody is being compensated for that risk or that hazard allowance they would consider. So it gives them a platform in this given time, and the fact that COVID has arrived, how do you compensate differently based on the risk factor and the new dynamics of security? Definitely for observatory and regulatory, we need to tighten frameworks and include civil society, because they are very critical. They can even add value in terms of how we prepare our futuristic projections and strategies.
Perfect. Thank you very much, Jason. And the last one is Sabelo.
Thank you. Without the effective regulation of the private security industry in all the parts of the world, we are not going to be able to fight a COVID. Because once you have an effective regulatory framework, then you will be able to have an effective regulatory agency that will ensure that the rights of private security officers that are actually the frontliners are protected and they are acting within the law. So it is important to engage more in this conversation, obviously by also promoting partnerships within civil society organizations as well as government, so that we can come together to find a solution to the issue. But most importantly, consultation is also key when events of this nature occur. And if it so happens that another pandemic strikes, the private security industry has to be involved in that kind of process. Thank you.
Thank you very much, Sabelo. And I will not try to summarize this webinar. I think this webinar in and of itself has provided us material for quite a few other webinars. But certainly from what I've heard, there's everything with regard to financial issues, question of information exchange, questions of collaboration between different stakeholder groups, issues of duty of care, issues of engagement with civil society organizations, the need to strengthen regulation, the need to ensure there's greater protections. And then beyond this particular stakeholder group we've had at the table as part of this webinar, all the discussions with regard to the other stakeholders beyond. We mentioned, for instance, insurance companies, the elephant in the room, the clients, those that are actually using security companies, their responsibility in that regard. So I think there's plenty for us to unpack. And I think I dare say, and this is where the negative part is, COVID-19 is not gone yet. So I think we're still in the first stages for a number of countries. So there are plenty of lessons learned that we can already take out of the first few months of the pandemic. And as we go into the next few months, into the next stages, I think encouraging more collaboration, consultation, discussion on these issues, as and when new questions and challenges arise, will be crucial in that regard. I'm conscious of the time, so I'll have to pause, unfortunately, this particular part of the discussion. I'm hoping on behalf of the International Code of Conduct Association and DCAF that we can continue this conversation with all of you, not only the panelists here, who are basically fantastic, I dare say, but also all those who followed this webinar and kept questions and comments coming in throughout the 1 hour. So without further ado, unfortunately, I'm going to have to, wish everyone farewell. Thank again the panelists for your time in the different time zones and for all of the wonderful ideas, comments, and some provocative ideas that were put to the table. So on behalf of DCAF and the International Code of Conduct Association, again, thank you very much, and I wish you all a good afternoon. Thank you.